Researchers continually discover safer, more effective ways to treat illness. We call it modern medicine. However, many of our present-day treatments actually have their roots in ancient techniques.
Healing, the process by which the human body heals, is both miraculous and complicated.
Body requires a number of things to take care of wound healing. First, we must stop bleeding, followed by the healing process of filling in the wound. That requires a certain amount of oxygen, nutrients, and appropriate wound care to bring the tissue together. Some wounds are more complex than the usual cut or scrape. For those, they may require special techniques. Other body complications can hinder wound healing, such as diabetes, poor circulation, require surgery, or even treatments such as radiation therapy.
The medical link between oxygen and healing has been known for centuries.
There's a much higher requirement for oxygen to heal a wound than to just keep the tissue alive. In order to heal the wounds, we require large amounts of oxygen to increase the cellular division.
The use of oxygen or air under pressure for medical purposes has been in use since the mid-1800s, when a French physician used a hyperbaric air operating table and found that his patients did better. In the more modern era, since the mid-1900s, oxygen has been used for healing under pressure.
Under Medical Director Dr. Helen Gelly, Dr. Daniel Belis and a full staff treat patients at several Atlanta area facilities under the Hyperbaric Physicians of Georgia. Dr. Gelly has specialized in hyperbaric oxygen treatments since the early 90s.
There are two ways of delivering hyperbaric oxygen therapy. One is in a monoplace hyperbaric oxygen chamber. Some of our centers, we have multiplace hyperbaric chambers, which are traditionally large chambers that seat between 8 and 12 individuals, all treated at the same time under the same pressure. In our newest facility at DeKalb, we have the only rectangular chamber that is in use east of the Mississippi. It is a very large chamber that almost simulates a room. The multiplace chamber offers a great deal more flexibility in patients in terms of their size. They're able to sit rather than lay flat. They're also able to read a book rather than just only watch a movie or television. And there is also some degree of camaraderie amongst the patients that treat all together at the same time. So we, by having incorporated both the monoplace and the multiplace environment, aim to be able to accommodate all patients.
During hyperbaric oxygen therapy, or HBOT, patients inhale 100% oxygen at a pressure level that's greater than sea level.
Most patients, when they start their hyperbaric oxygen therapy, actually feel no changes except those associated with pressure, very similar to going up into an airplane and feeling your ears pop, or driving up into the mountains when your ears start to pop.
Experts say the combination of increased oxygen and increased pressure provides the body with approximately 20 times the normal oxygen levels.
The way hyperbaric oxygen works is that oxygen, which is inhaled, interfaces with the blood and the plasma part of the blood in the lungs, and that oxygen is dissolved in higher concentrations in the blood and then carried to all the parts of the body that need additional oxygen.
According to Dr. Gelly, hyperbaric oxygen therapy has a multitude of indications and promotes greater healing.
My entry into the field of hyperbaric oxygen therapy started with the emergency treatment of carbon monoxide patients and those patients with arterial gas embolism. But as time went on, the amount of patients that were helped that had non-healing wounds and radiation-induced injury became much more fascinating to me. Although it's difficult to judge just how much hyperbaric oxygen therapy will help a wound to heal, it is not uncommon for wounds that haven't healed in 6 to 8 months to be healed in a matter of 2 to 3 months. So there's definitely an acceleration of wound healing in those patients that have compromised wounds.
This is my 9th treatment, but after my 3rd treatment, I can see a big difference, a big change in my wound. I had new skin growth after the 3rd treatment, so I was very, very, very happy.
Dr. Gelly is a national figure in hyperbaric medicine. She's helped not only in some of its clinical applications, but also developed the largest center here in Atlanta for treating hyperbaric medicine.
I think as more and more physicians are approached by patients asking whether or not hyperbaric therapy would be beneficial in their particular disease, I think that physicians will then be forced into acquiring more knowledge on the appropriate patients for hyperbaric oxygen therapy.
It is a decades-old medical treatment that gains more and more popularity with time. Oxygen therapy. Today, modern techniques and technology, combined with expert knowledge, is creating more favorable outcomes than ever before. The benefits of oxygen therapy have been known for years. At Hyperbaric Physicians of Georgia, our patients experience healing from conditions including diabetic-related wounds and radiation therapy with significantly better healing success.
I think that there is a great need for more awareness, not only in the general community, but in the medical community, of the benefits of hyperbaric oxygen therapy in patients that have non-healing wounds or radiation-damaged tissue.
Our expert physicians specialize in hyperbaric medicine, using state-of-the-art hyperbaric oxygen therapies to provide one of the most comprehensive hyperbaric treatment programs in the North Georgia area. Hyperbaric Physicians of Georgia, a new level of care.
Some great people and ideas. We're glad you can join us here on the Profile Series. Be sure to join us again next time for more stories of success. I'm Lou Gossett Jr.
For more information, call 770-422-0517 or visit hbomdga.com.